Hello, my name is Mark Starr. I'm a medical doctor, and today I'm going to tell you how to both prevent getting diabetes and how to treat it should you have it, so you won't develop any of the complications from diabetes. After you hear this presentation, I can tell you most of your questions will be answered by the statement, when medical treatments do not make sense, the answer is always dollars and cents. Most people do not realize that almost all the complications from diabetes is due to hardening of the arteries. And the thyroid specialists I'll tell you about shortly realized that hardening of the arteries was largely due to hypothyroidism, so low thyroid function. There's certain things that are both found in both diabetics and hypothyroid patients, and that includes muscular weakness, susceptibility to infection, elevated cholesterol, poor wound healing, diminished circulation, and a host of other things. The first report in the literature which found a greatly diminished incidence of the complications from diabetes, such as blindness and kidney failure and heart attacks, was in 1954. Dr. Crosby D. Eaton published his report, and he treated hundreds of diabetic patients who suffered hypothyroidism, and he knew how to treat them properly with the old-fashioned desiccated thyroid, and reported extremely few complications of all of his type 1 and type 2 diabetic patients. It didn't matter whether they were type 1 or type 2. And the report was called Coexistence of Hypothyroidism with Diabetes Mellitus. And that was published in 1954, 1 year after I was born. Another doctor that I just spoke of, Dr. Broda Barnes, was an MD, PhD endocrinologist who received his PhD in physiology of the thyroid gland in 1930, taught endocrinology and did research on thyroid for 7 years before becoming an MD, and did a long-term study involving about 1,600 patients lasting 20 years. There were 42 diabetic patients in his study to prevent heart attacks, and he only had one 67-year-old woman have a minor heart attack in the 20-year study. None of the other diabetics had any complications either, and he reported his research in his book, Hypoglycemia. Hypoglycemia, it's your liver, not your mind. He also had several other books, Hypothyroidism, the Unsuspected Illness. So no other complications were reported in his diabetic patients, and new incidences of diabetes were extremely rare. So over 20 years, with about 1,600 patients, the people who came into the study and were placed on thyroid rarely, if ever, developed diabetes. So all of my diabetic patients that I've been treating the last 15 years, in my opinion, they were all hypothyroid. None of my diabetic patients have developed any additional complications other than the ones they already had. When they came to see me initially, I had 3 patients, probably out of about 1,500, who developed diabetes. All 3 had not yet reached a therapeutic dosage of thyroid. You'll have to read more about the dosages later. So none of my patients on what I consider, and Dr. Broda Barnes considered, a therapeutic dosage of thyroid has ever developed diabetes. So kidney failure was called contracting granular kidney back in the late 1800s, when they found out what hypothyroidism was, and they would do autopsies on the patients who died because they didn't know how to treat it until 1891. So chronic kidney failure was a very commonly found cause of death back then. And I have that research in my book. Every aspect of your metabolism is negatively affected when you're hypothyroid. Accelerated hardening of the arteries is one of the main things that happens when you're low thyroid. Dr. Barnes, 1,600 patients or thereabouts. There were over 100 who came into a study with high blood pressure. 80% of those patients, blood pressure normalized with just proper treatment of hypothyroidism. In my 15 years of treating hypothyroid patients, I can tell you it's more like 60% these days. I think people are much more sick than they used to be. Hypothyroidism causes susceptibility to infection, and for thousands of years, the people susceptible to infection died of plague, smallpox, tuberculosis, and other infections. And since 1945, when we introduced antibiotics and antituberculin drugs, the hypothyroid population has mushroomed. So there were no cases of chronic renal failure in Dr. Barnes' long-term study. I have had 0 cases of chronic renal failure. I've had no complications as far as vision problems. And if you read my book, there's a testimonial by one of my diabetic patients about how wonderful her eyes are doing. In order to learn all the detail, you'll have to read my new ebook, How to Prevent Heart Attacks and Complications. And I also have a book dedicated solely to the treatment of hypothyroidism. So if you're a physician, I would recommend purchasing that book first.